This episode of Housing for Good is brought to you by listeners and supporters just like you. If you believe in creating safe, stable, and affordable housing for everyone, consider supporting the McPherson Housing Coalition. Your donation helps us provide housing solutions, support services, and hope to those who need it the most. To donate, visit our website, McPhersonHousingCoalition.org. All donations are tax deductible. Thank you.
Welcome to Housing for Good, a podcast dedicated to housing topics and issues affecting our communities in McPherson County and beyond. With years of experience and expertise, hosts Chris Goodson and Karolyn Moore discuss housing challenges and opportunities with other experts from a variety of housing fields.
Hello, and welcome to this week's episode of Housing for Good. I'm Karolyn.
And I'm Chris.
So, Chris, we have had quite the busy day this morning, and I don't have any local news. The only thing national is we are waiting to see what happens with President Trump's skinny bill and how that affects the housing programs that HUD has. Do you have any other news?
No, I'm really looking forward to our countywide meeting that we're having in July, bringing back all the stakeholders from around the county, and we're still in the planning stages.
Yeah.
And so it's been a challenge getting all of that together. You know, everybody wants to kind of do their own thing, and I think the days of that are over.
Yeah.
We've got to learn to work together and to collaborate and to make sure that we're making wise decisions, because if we're all doing the same things, that really is a waste. So we want to make sure that we're doing them strategically and effectively. So that's all I have, really. So I'm excited. Who's our guest today, Karolyn?
So that was what you just said was a perfect segue over to talk to Becky Gray.
Okay.
And Becky is with Building Health Initiative. So Becky, introduce yourself to us and tell us a little bit about the agency you work with.
Well, thank you for having me. It's so good to be here, Chris and Karolyn. I appreciate the invitation. My name is Becky Gray. I am the director of Building Health Incorporated, which is a nonprofit subsidiary of the Community Health Center of Southeast Kansas. So we'll call that BHC, and we'll call Building Health BHI because it's quite a mouthful to say the full title.
That is a mouthful.
CHC is a federally qualified health center that's been around for about 20 years in Southeast Kansas. Our mission, the mission of the health clinic, is to provide access to health care regardless of the patient's ability to pay. They've been at this for just about 20 years, and the data nationally demonstrates that the clinic and what happens inside of a clinic is responsible for about 20% of a patient's health outcomes, and that other 80% is influenced by the environment that patient lives in. So that was the impetus for the Community Health Center creating Building Health, was to address social determinants of health like housing, very relevant for our conversation here, as well as transportation and food access.
That's all connected. It's all so interconnected. And I think that's what we figured out as we were building the Oak Harbor cottages, was all of this is interconnected. We can't fix the housing situation without addressing the health situation, without the daycare situation, it's all interconnected. And I'm so excited that it sounds like you were really on the forefront of this if you've been around for 20 years doing this.
Well, Building Health Inc. was established in 2020.
Okay.
But the health clinic has been around for 20 years. And to be fair, the health clinic has really been addressing social determinants of health through community health workers, which is a certified training that a person can take. And then those community health workers walk with patients hand in hand to help connect them with the right things in their community, whether that's transportation or access to food or laundry or whatever it might be.
Okay. So how did Building Health Inc. get started in 2020? How did that come about?
So that was before my time, but I believe that the impetus was really on the 80% of influence of our health outcomes is from outside of the clinic. And if you're familiar with the data and the environment of Southeast Kansas, we are typically referred to as the poorest part of the state, and our housing stock is quite old. And I believe that the leadership at Community Health wanted to address that housing stock for multiple purposes. One is we can see how sick a really bad house can make a person. Think about mold and water influence.
Oh, yeah.
And then also, as the health clinic was trying to recruit medical providers to work in rural America, the lack of decent housing was a real barrier. So I believe that was the beginning impetus. And then we have kind of grown to do public transportation as well, because we're very rural and we know that a lot of people are relatively isolated in smaller communities and they can't access the goods and services that we have in larger communities. And then we're also addressing homelessness.
And when you don't have any transportation, your life is so difficult. You think about, how do you get to the store? How do you get to the doctor? How am I supposed to get a job? And how do I get there every day?
How do you get your kids to school? I mean, it's all connected. Everything is so interconnected.
It's everything.
Yeah, it really is interconnected. So sometime later, I'd really like to hear about that transportation piece, because I think, honestly, that's a big problem for us as well.
Yeah.
I mean, we have rural communities all over McPherson County that we have lots of jobs here. But if you live in one of these smaller communities and you don't have a car, how are you supposed to make that work? And so it'd be interesting.
Right.
I'm very curious as to see how that piece is working and how you did that. But so Karolyn's got a question.
We'll have to get together again.
Yes, we have to get together. So she has something here that says, tell us about the big idea. So I'm curious. I'm hoping that you know what that is. She
sure do.
shows me these questions. I was like, I hope that's something, because I don't know.
Yeah. So I mentioned I wasn't around in 2020 when the organization started. And so there was a bit of a different strategic direction at that time. I was hired in 2023 to operate the organization. And I really don't know how to work without a strategic plan, especially when the goal that I was given was to solve homelessness in Southeast Kansas. And I thought, well, we need a strategy, because that's a pretty big goal.
That's a good idea.
So the big goal came with a big idea behind it. And what we know about homelessness, housing insecurity, poor health outcomes is that they're the result of a complex systemic issues, right? They're not individualized necessarily. So it would require a multifaceted approach. So my board of directors adopted a 15-year strategic plan so that we knew we were aiming in the right direction. And it included 6 major strategy categories. Of course, number 1 is increase the supply of housing. We need to build more houses. Preserve existing housing as long as it's not too far disrepair. Provide increased access to employment and increased access to health care. Co-locate supportive services so that we don't keep asking our clients to do what I call the social work shuffle, where you just ask them to run around town doing different things.
Oh my gosh, that's always been a pet peeve of mine. Is why are we making people run around to try to get assistance when they're already struggling? And so that keeps them from getting a job or all kinds of things when they're running around just trying to get the basics.
And they're running around without transportation, so it makes it even harder.
Yes.
And I think
then the last piece... Oh, go ahead.
No, go ahead.
Just the last piece of the big idea is to establish increased community engagement. We want to increase social capital bridging, as we call it, so that we can increase the social capital, obviously, of people who could use that to scaffold into better employment and better housing situations.
Okay.
I love it. That is a real, those are big issues.
They're big issues.
You didn't try to tackle one thing. You put it, no wonder it's called the big idea, because like one of those is by itself is a lot. Let alone putting all 6 in there together. So that takes a lot of coordination on your part and within your staff to try to figure out how big are you to be able to do something like that?
Well, so I think that's a great question, because we're not big. We're pretty small. And the activities inside of each of those categories aren't all being attended to by Building Health, Inc. Some of it are my colleagues at the Community Health Center. Some are our colleagues at the Community Mental Health Center. But the big idea is that as a community, we can track progress in each of those areas. So while some of the initiatives in the big idea are sitting on my desk, others are sitting on other people's desks, but I am responsible for kind of tracking the progress and reporting back out to the community.
Well, and I love how this is pulling in different agencies. You're not recreating what somebody else is doing. Mm-hmm. You're just simply tapping into what they're doing, letting them do what they're good at, and you come alongside of them. So where are you in regards to each part of the plan? So you said increase the supply of housing. Where are you with that?
Oh, we have just a really great strategy. I'm so excited about it. We focused on one census tract based on data. So we found the census tract in Southeast Kansas that has, all the data that we're not proud of. And if you go into that neighborhood, you can see it in terms of dilapidated housing and systems or symptoms of poverty. Mm-hmm. And so in that neighborhood, we're fortunate that our city of Pittsburgh has a land bank. So we have been purchasing lots from the city of Pittsburgh in their land bank at a fairly discounted price. And on those lots, we're building single family homes. Awesome. And then those single family homes are being purchased by a nonprofit called Level Playing Field. And what Level Playing Field does is they receive applicants that have a sponsor attached to them. So if you were looking to buy a house, I could sponsor you, and we would go to Level Playing Field. And Level Playing Field staff then counsels that applicant about financial management, financial strategies. Then they assist that applicant in buying the house. So they essentially act like a lender, but what it's doing is it's building generational wealth through home ownership.
Well,
so
and
we've got, I think,
I love your kind of credit counseling, home ownership counseling that you give, because if you've never owned a home, if your parents didn't own a home, there's a lot you go into not knowing if you're the first generation to buy a house. So it's easy to make mistakes. And sometimes those mistakes can be really big and difficult to deal with. So I love that.
Yeah, surrender.
You're exactly right. And that's actually why the sponsor is necessary, right? Yeah. Because the sponsor then is that person that the new homeowner calls when the pilot light goes out. They're not sure what to do about it, right?
Yeah, that's an important call. Yeah. So I think it's the same thing like when we do with our properties. We have them, they have a case manager, and they work with somebody to help them through life's difficulties. And that's what you're doing with this housing piece, is that you are saying, okay, I'm not just going to put you in a house and give you a payment. I'm going to teach you how to walk through this responsibly so that you don't get evicted, or so that you keep the house in good repair. It makes sense. And I think over the years, it's really the piece that we've been missing. It's why some of these low-income housing complexes start to fall apart, is there's nobody there to be an advocate for the families, or to teach them, or to whatever you need. So this is brilliant. I love it, and it's a great idea.
Thank you. It's exciting, too, because it's not just us doing it. The local lumber yard is playing a role and conveying construction materials at a pretty steep discount. And there's private property owners that are also building and selling to the Level Playing Field as well. In the same census tract, Habitat for Humanity is building. So it's really turned into a community effort. And that's what I mean about the big idea not being just mine.
No, I love it.
I'm just tracking the data.
What about existing housing? Tell me what you are doing with that. How is that being handled?
Boy, that's a little bit harder. So initially, what we're looking at, because the staff that we have internally has the capacity to build ramps. So we are really just trying to help people stay in the house that they're in longer by making it accessible. So that's step one. Step two to that then is right now I'm applying for funding through a foundation that would allow us to hire 3 more people in our residential building staff. And then the idea behind that is we're going to call it building builders. Those 3 people will work alongside of our residential construction manager who used to teach construction trades.
Perfect.
They will learn from him. And then as the subcontractors come in, the electricians, the HVAC, the idea is that those 3 employees will work with the subcontractors. And we are telling the subcontractors, please do recruit. from our staff. And then we can bring more people into those roles, and they can learn the basics of construction, and then they can move on and do apprenticeships with local businesses.
This sounds like what you're talking about. Is it a self-help housing program that you're doing?
No, not at all. No.
Okay.
No, we would be paying those individuals to learn the construction trades.
Okay.
And then work alongside of our local contractors and hopefully get recruited. And then those 3 individuals under management of our residential construction manager could also do home modification. So I have several different applications out for funding the home modification piece. But as it stands, ramps are affordable.
Yeah.
And they're needed.
Yeah.
They are very affordable and needed. We have a program called Brush Up Mac, and that's a lot of what we do. We put up wheelchair ramps and grab bars and all that to keep our seniors housed.
Yeah.
Because a lot of times that's what they need. They just need simple stuff. You know, it's not anything big.
Okay. Another one of your pieces is the provide access to employment. Tell me how that works, because that is one area that I feel like McPherson Housing Coalition could use some help in getting these people employed.
And staying employed.
Yeah.
Sure. Well, public transportation, I think, is a big part of that. A lot of our riders are going to and from employment. So we provide public transportation in Crawford, Bourbon, and Cherokee counties. And then we provide non-emergency medical transportation on a much wider geographic area. But public transportation, I think, is one piece.
Okay. How do you do public transportation with maybe the shift work that goes on? We have a lot of shift work in McPherson. So you have people going to work at midnight and getting off at 8 a.m. or going in at, 4 o'clock in the afternoon, and they got to get off at midnight and get a ride home. How do you manage that?
I don't, actually. We haven't cracked that nut yet. Most of our drivers, this is kind of their second career. I don't have drivers that want to work those late hours.
Okay.
So we really haven't tried to address that yet.
Okay.
So it's just normal hours, like 8 to 5 or 8 to 6 or something.
That's correct.
That's hard. And that's been our thing as well, is that we have so many shift workers here and trying to fit not only transportation, but daycare as well, trying to find a place for their children. Even when they make really good money, sometimes they can't find people to take care of their kids overnight. So those are two big things that we all need to figure out how to address.
Yeah, the other way we're providing access to employment is through just workforce education and training. When we were operating the Wesley House for a period of time here, and that's the largest food pantry in Southeast Kansas. And for a period of time, it was also a day shelter for people who are experiencing homelessness. And I had an intern, a public health intern for a little while. And she did a survey there and asked the population what kind of training they wanted. And the number one thing was learning how to read. So we thought, okay, if we're not reading, we're not really going to go to Kansas Works and work through their process because we can't read it. So fortunately for us at Pittsburgh State University, there is a center on reading. And Dr. Herford, who runs that, has really cracked the code on teaching a new way to learn how to read, particularly for adults and people who have learning struggles. So his staff is very excited to work with us to train people who have lived experience of homelessness on how to screen others and how to train them to learn how to read. So that's pretty exciting.
That is, it's funny. We think about it. We want to do all this stuff to help people. And then what we forget to do is ask them, what do you need? I mean, I would not have guessed that they can't read.
Yeah.
That wouldn't have been my thing. I'm when you're getting ready to say that, I'm on my mind. I'm like, what do they want to be, a dog groomer? What do they want to do? Nope, you're wrong. They just want to read.
Yeah.
So So we got to remember that when we're trying to do things to help people experiencing any kind of difficulty, that we need to ask them.
Yeah.
Make sure you have the right people that are there to answer the questions that you have. Otherwise, you can't. You're moving forward and it's not successful.
Yeah.
There's that old phrase that nothing about us without us.
Yes.
Right?
Yes. So enhanced access to healthcare is the fourth piece of this, and you've kind of touched on that you partner with the clinic down there. The next one is where I really want to go, co-locate support services. And tell me about that. What does that look like?
Yeah, so this is very exciting to me. The Kansas Housing Resources Corporation had a grant opportunity when I first took my seat in 2023 that I applied for through the Home ARP funding. And it was very a wide open funding at the time during that one Home ARP. And so I kind of shot the moon and I said, we really need a place where a person can get their basic hygiene met, and they can also learn, and they can also feel safe, and they can store their belongings so that as we address homelessness, there's a place for people to be. So that was funded. And that will include, we're calling it the station. So it's about $2.78 million from the state. And I have $1.8 million in philanthropy. And we will start construction on that as soon as we get our state contract signed. But it will contain one building that we're calling an adult education center at the station. And then another building has 10 rental units in it. They're efficiency units. The idea being, first in the adult education center, there's kind of two sides of the house, if you'll picture this. And if you come in from the east, that's where you'll find lockers and showers and restrooms and hydration station, a commercial kitchen that's also going to be employment training, right?
Awesome.
Because we have a beautiful commercial kitchen that will be able to get Serve Safe certified there and do cooking classes and feed everybody. There's also on that side of the house, there's access to 2 exam rooms, one for mental health and one for physical health. Another thing we learned when we did the survey down at the Wesley House was there's a lot of distrust of institutions. And so even though we have this wonderfully warm, welcoming clinic here that's available to all without regard to pay, some of our friends still don't feel comfortable going there.
Yeah.
So having these exam rooms attached to this space where all of our other basic needs are met allows us to establish primary care and primary and mental and behavioral health care.
Wow.
In a safe environment. Then on the other side of that house, we have some classrooms and a computer lab, conference rooms, Zoom rooms, so that we can practice our computer skills. One of the survey respondents said, what does right click mean?
Oh.
And we thought, okay, if we don't know what right click means, we're not going to be able to use the Zoom. So, so that's going to be a place then where our community partners, other members of our continuum of care, will have drop-in desks. So that when we say, well, it's time to probably go fill out the application for Section 8 housing or housing choice vouchers, they'll be right next door.
Yeah.
And we can just walk around the building and go in through the next door and access those services.
That's amazing. I wish we had something like that here in McPherson where somebody could have a big space. And we tried to do that years ago, but we just couldn't get our nonprofits to understand that collaboration is not only good for the organization, but it's so good for the people that are needing assistance. We just have to figure out a way to put everything together for them.
Yeah.
So
it's, I was surprised because I've been at this work for quite some time, and it very much used to be the communities didn't really want to collaborate, right? I think there was I'm protecting my funding, and if I tell you what I know, then you might come get my funding, right?
Yes.
I feel like that is really dissolving, and I don't know if that's just in our region or if it's across the board that we all realize none of us are going to fix these issues. We have to work together.
Right.
We have to collaborate.
And I do think that is a little bit people protective, working in those silos. But I think if you live across the country right now and it's not working where you live, I think you just need to get out there and start talking about it and seeing that it's not that it's not a threat, and that we can together, we can accomplish so much more than if we try to do it by ourselves. Establishing authentic community engagement, what does that look like?
Well, I think it looks like a lot of things, and most of them are not off the ground just yet. I mentioned that we're waiting on a grant from the Kansas Housing Resources Corporation, and once that comes through, I'll have the funding to hire the staff that can help carry forward with the actions. But so far, I think the actions that we've taken include the survey that I've mentioned previously. And understanding, what people who are living the experience need. And then also communicating out with our partners in a very consistent and transparent way. So back to that strategic collaboration, right?
So I have a quick question.
Sure.
About that. So when you're passing out the surveys, do you have any resistance? Sometimes we have a little resistance with that. And I was just curious, is when you're talking to people, you may have some resistance that maybe they don't feel comfortable giving you information, or how are you doing that?
So the surveys were conducted by a Master's of Public Health student, and she had questions written down, but understanding that some of the respondents had difficulty with reading and writing, she really engaged people in conversations. The environment in which she was doing this, it was an environment that was being used as a day shelter at the time. And the guests were quite comfortable there.
Okay.
And they were comfortable with the surveyor.
Okay.
Right.
Okay.
And so really they looked a lot more like conversations. And she would disclose, this is what we're doing. Do you mind talking to me? And then have a conversation. And as the conversation progressed, of course, she was asking the questions that we had agreed upon. And sometimes she would learn information that we didn't even think about asking. But it was really more of a conversation as opposed to a pen and pencil survey.
Well, that's a really great way to do it then.
Yeah.
Is just engage people in a conversation instead of saying, here's a survey, go fill that out.
Yeah.
That's right. We focused on qualitative instead of quantitative.
Yeah. That makes a lot of sense.
There was also in conversation you and I had prior to this podcast, you talked about specialty court. Explain to us what that is.
This is so exciting to me. The specialty courts are not mine, right? They're my colleagues.
Yes.
The 11th Judicial District's Recovery Court was started by Daniel Kreitz. He's Community Health Center's Chief Compliance Officer. And that is a diversion for people who receive drug-related convictions. So It doesn't have to be necessarily possession or distribution. It could be burglary because I was trying to get money for the drug.
Okay.
And then in the city of Pittsburgh, the municipal court diversion program was started by Abby McCoy, who is CHC's research and development coordinator. And that is a diversion program for nonviolent misdemeanors within the municipality. Those are typically failure to appear, trespassing, dumpster diving. I call them crimes against homelessness, right? They're being punished for being homeless.
Yeah.
Yeah.
So now Brian Dyson is our specialty courts program coordinator, and he oversees both of those programs. He has 3 community health workers, all who have lived experience of addiction, and they're living in recovery right now. And they provide individualized case planning for their clients. But we also share clients. So our homeless programs manager and those community health workers work very closely together. It's a fantastic program, just got started. There's already 19 people in it. If they're successful through the program, they have their charges dropped.
Oh, wow.
And should have housing and employment, should be in recovery, should have a peer support network around them. So I would highly recommend you invite Brian on the
Yes,
the call.
I love.
Yeah.
People do not realize that if you have a felony, even though it's a certain age, you can't get employment a lot of times. You can't get housing. So we have an eviction clinic that we help people go through. I think ours is in October or September next year, or this year actually. But if you could stop it before it gets to that place, then you're going to be able to help them get past a lot of those roadblocks.
And like Becky said, so you have a charge against you, but then you don't make it to court.
Yeah.
So now that's another charge against you.
Because I don't have transportation and I don't have a permanent mailing address, and I don't have, I probably didn't even know, or
exactly.
Probably, who knows?
Or I don't have a phone that works, so I don't have I don't know how to use the electronic calendar. And so these community health workers in this program, I think Sherry refers to herself as Mama Bear. She'll make sure people show up where they need to go. She'll drive them where they need to go.
That's amazing.
Yeah. I love it because
it's a pretty good thing.
That program, the way they're running it, that is stopping the situation before it gets to where you have now to have an expungement to get your record cleared. If you're willing to go through the process, that's amazing. I absolutely love that. Okay, well, I'll get information from you later how to contact Brian.
So I'm curious about, what type of struggle? So this is a big thing that you're doing. Lots of moving parts, lots of stakeholders, lots of people that you're trying to bring together to try to make this whole thing work. What did this? I always like to know what the pitfalls were. How did you fix that? I mean, you had to have eventually convinced people like this is what we need to do. What did that look like?
Well, so this initiative overall is very focused on Crawford County, specifically Pittsburg, Kansas. Within the city of Pittsburg, Kansas, people really work well together. It's a remarkable place to work. So getting collaboration to occur has not been hard. We do have critics, of course, right? If you build it, they will come. That's what they say about us. We're importing people. You know, you've heard this story before.
Yeah, we've been accused of it as well. Yeah, just
exactly.
saying.
And so that has been a struggle, but I think, you know, by continuing that consistent and strategic communication to our community partners, I think we've turned the corner. Yeah, I think that the ears that those critics have are getting fewer and fewer. So I think more people are excited about the progress that's being made and less excited about the complaining. I think our biggest barrier is two things. One is zoning, and it always goes back to zoning with me. I can talk about it forever. You know, there's and this is my math, so if somebody checks it might be completely wrong, but I think it's pretty close. 5% of the land in Pittsburg, Kansas is zoned for multifamily, and 0.5% is vacant. And that 0.5% happens to be sandwiched between an EPA brownfield and a railroad. So no funders are going to put federal, housing funding in that environmentally unjust location. So building multifamily is a trick. As you know, you have to go through a planned development process. And fortunately, the station has enough support that going through that process was quite easy. We did not receive any pushback from the community during that. But if I wanted to, bring in a low-income tax credit project and, have 40 units, I'll have to go through that process again. And I don't know that would be as easy.
Yeah.
And then I think the other struggle that we face is always funding, particularly right now when who knows what's happening with the funding, all the tools that we're accustomed to use to build houses financially are, I don't know what they're going to look like next year.
And the support services, that's the part that has us a little bit. That's the support services. Yeah. We have TBRA and CSBG and all of that. And we're like, what is going to happen with that? So, we have some big concerns about that as well. We're just trying to figure out. We're trying to get really creative. So if those do go away, okay, what does that look like? And what do I need to do to make that funding up?
Well, and I think, Becky, I would just encourage you. I mean, I love what you guys are doing. I want to come to Pittsburgh and check this out.
I know, right?
But as soon as people see that you're successful, then they're more open to listening to what you want to do next because they've seen that you are successful with the first thing. We had that with our emergency shelter cottages. We had some pushback on that, and, we went ahead and pushed it through and kept moving forward. And then when we went back to do Sutherland Estates, our permanent supportive housing, the people that were against us to begin with actually came to the city meeting and said, yes, let them do this. They know what they're doing. Yeah. So it just takes time. It takes time.
It was fun to watch. I mean, not so much fun. I was the one being yelled at in the middle of the street. Somehow it was always me they were screaming at or whatever. And I'm like, I'm sorry. I'm not trying to hurt your neighborhood values or anything. I'm not trying to do anything to bring the neighborhood down. I promise. And, we did put it in an older part of town and we were really making sure. I mean, the property is very, very nice. Yeah. We wanted sometimes I think it looks better than some of the things around it. I don't know if I'm supposed to say that here, but I mean, really, we do a good job, and we have somebody now that takes care of our property, volunteers and comes and mows the lawn and edges, and it looks amazing thanks to him. So thanks, Kirk, if you're out there.
So keep pushing, keep pushing forward, Becky, with what you're doing. Yeah. I love the concept. I love everything you shared with us today. I feel like we could do this again and talk some.
Yes. I do have one quick question though before we go, and when you started this process, did you have community meetings? Did you do that, or you just got on the phone and started calling people? I'm just curious because, we may have listeners out there. They're like, I love what they're doing in Pittsburgh. How do I get started? What's the first thing I need to do?
Yeah, that's a great question. So I walked into a community meeting actually. So it was probably my second month working at BHI, and the loud critic that I mentioned earlier hosted a town hall and invited a bunch of housers to essentially defend ourselves in front of the public.
Oh my God!
And so that's literally how it started.
Okay.
From there, however, the CEO of the Community Health Center, again, a very successful woman who has brought this health clinic up from its humble beginnings in a single wide trailer to now having 19 clinics across Southeast Kansas.
That's incredible.
She leveraged her social capital and pulled together a team of community leaders, funders. We had sheriff, we had the chief of police, you name the mover and the shaker, and they were in the room. And that's when they pointed at me and said, "Go ahead and fix homelessness, Becky."
Okay.
So from the beginning, I had buy-in of, from the beginning, there was buy-in from a lot of political capital.
Mm-hmm.
And you weren't,
is a good way to say that.
You weren't really starting from the beginning where we've had to educate people about the fact that we even have this problem. And so that's really good that you were able to get there on that floor. But anyway, so this has been a great interview.
Yeah.
Yeah. Yeah. And then from that one, I did then convene. Well, I hatched the big idea, which really is, if you look at those 6 initiatives, it just makes sense. You have to do that, right?
Yeah.
And then I presented that to our community of social service organizations and community foundation. And everybody agreed. They all just said, yeah, let's do this. We're behind it.
Awesome.
Lead us.
Cool.
So it was not a hard process. I do think that maybe is because prior to this position, I worked for the city of Pittsburgh for quite some time and for a community action program. So all of the data education and the cultural education around poverty had been going on for a decade at least.
Okay. Well, hey, thank you so much, Becky, for talking with us today about Building Health, Inc. and telling us about your programs. I absolutely love what you're doing. Keep it up. If you would be interested or know someone who would be interested in being on our podcast, Housing for Good, drop us a line at housingforgood@mcphersonhc.org. Be sure to click like or follow if you're watching our podcast, and have a great day.
Yep. Have a great day, everybody.